Hi, this is Dr. Mark Taylor at the Gateway Aesthetic Institute and Laser Center in Salt Lake City, Utah. Today I'd like to discuss with you the evidence-based hair restoration options for women. This can be a very frustrating problem for many women, and so it's important to understand both the causes and the treatments that are available. So what are some of the causes? Well, pattern hair loss in women is often genetically determined. Uh, this can run in families with a history of hair loss both in men and women. Usually if it's androgenetic hair loss or genetically induced hair loss, it's diffuse and has somewhat of a pattern reduction. And there are scales that show this type of pattern reduction. Both the Ludwig and the Sinclair severity scales have different gradings for this type of hair loss. There are also many other factors, hormones, thyroid, and so forth that can cause hair loss. And also it's very important if you are taking medications to look at the possible link between your hair loss and some of the medications you're taking. Fortunately, today we have some nice tools like ChatGPT and other AI programs that can quickly summarize those medications that are known to cause hair loss, and you can also search your specific medications to see if they may be the cause of your hair thinning. If that is the cause, then you may want to consider discussing changes in medication with your doctors. So there are also other conditions that can cause hair loss, and these are hair diseases. It's very important to check with a board-certified dermatologist to verify your type of hair loss. There are many diseases that can cause temporary or even permanent hair loss, so it's important to know what the correct reason is and correct etiology for your particular hair loss so that your therapy can be the best evidence-based therapy for that type of hair loss. So what are some of the medications that can help regrow thinning hair, especially in the androgenetic alopecia type of hair loss? Topical minoxidil, 2 to 5%, can be used, and that has been scientifically proven to help. More recently, we as dermatologists are excited about the efficacy of oral minoxidil to help regrow thinning hair. Also in women, some women will respond to spironolactone, 50 to 200 milligrams a day, depending on the hormonal influence for their hair loss. Finasteride and dutasteride can also be used in postmenopausal women, but should not be used in women who are at risk of becoming pregnant, because this could interfere with the development of a male baby if the hormones are blocked during pregnancy. Minoxidil, both the topical and oral, improves follicular size and anagen duration. Anagen is the growth phase of hair, and so if that's prolonged, the hair will stay in longer and be healthier. Topical use of minoxidil can be used and may show some early shedding, but that is usually temporary, and then some sustained hair growth will occur if the topical minoxidil is used on a regular basis, which is usually twice a day. The oral minoxidil is stronger and more consistent in producing good results for hair restoration. Postmenopausal women like this woman here can see a very nice improvement in minoxidil and finasteride used in combination orally. This improvement can also be combined with some of the other therapies I will discuss in a few minutes. I really like low-level laser therapy. We use a long-pulse erbium YAG laser made by Photona to do something called hair restart, and feel that this is extremely useful in promoting healthy hair restoration. There are many FDA-cleared caps and helmets that primarily use low-level light, also evidence-based for improving hair growth and health because they increase mitochondrial ATP. This is necessary in the metabolic processes to have healthy hair. Typically, these will improve density in 3 to 6 months of consistent use. I don't know if you've ever heard of paradoxical hypertrichosis. This is actually a side effect of laser hair removal. Sometimes physicians or laser technicians will try to remove hair but use too low of a fluence or a power to be effective hair removal. However, they will then get hair regrowth or even stimulate hair growth. This is a complication when trying to remove hair, but this effect can also be used to grow hair more thoroughly, with more density and more health. So we often use both lasers and other energy devices to stimulate hair growth. And recently there are more devices that are being approved by the FDA to stimulate hair growth and restoration. PRP therapy, what is that? Well, if we take blood out of your arm and spin out the red cells and process this, we get PRP, which is platelet-rich plasma. This has growth factors that stimulate the follicles. And typically, if this is done, we recommend 3 to 4 sessions, anywhere from a couple of weeks to a month or more apart. This also is evidence-based in scientific studies to stimulate hair regrowth. This is an example of the stimulation of long pulse erbium from Photona for hair stimulation and growth. We have quite a number of people who feel like if they do this once every few months, they get very nice restoration of their hair density and thickness. And this is an easy procedure to do. It takes just a few minutes every few months, and has been highly accepted and preferred by many of our patients. And this can be combined with the oral medications or the topical medications to give even stronger combination therapy. Now, hair transplantation in women is actually not super common, but in women who have diffuse hair loss in the widow's peaks or on top of the head can have a hair transplant. In this process, hair is taken from the posterior scalp around the back and up over the ears, and then individual hair follicles are transplanted into the thinning areas. This is also ideal for men who have stable androgenetic alopecia, the common type of balding, and selectively can be used in women with hair thinning. This is an example of neograft follicular unit extraction hair transplant. What that means is that individual hair follicles are removed and then transplanted into areas of hair loss, such as this person here. Unique to women is the neograft hair transplant to the eyebrows. Very common is loss of the lateral eyebrows in women postmenopausally. So hair can be removed from the scalp, in the back part of the scalp, and then transplanted into the eyebrows. The only difference is when scalp hair is transplanted in the eyebrows, it will grow long just like as if it stayed in the scalp. So once every week or so, it's important to trim the eyebrows if you've had a neograft hair transplant from scalp hair. What about nutritional supplements? We see a lot of advertisement, a lot of potions and lotions that are advertised. There are some types of deficiencies that will cause hair loss, and there are also some vitamins that will help to maintain healthy hair. Vitamin D, ferritin, iron, omega-3s. Vitamin C is important for collagen support and hair growth. There are a couple of brands of vitamin supplements called Nutrafol and Visical that have scientific studies that show they will support normal and healthy hair. It is also important to have plenty of protein and other essential nutrients to maintain healthy hair. A lot of people hear about biotin. This does not increase hair density in androgenetic hair loss or improve hair growth in people who have normal biotin levels, but it does help in those who are biotin deficient. Melatonin is not commonly talked about in hair loss, but topical solutions of melatonin can improve shedding and early thinning. Again, lifestyle, it's important to have a good diet that includes protein intake. It's good to avoid heat and chemical damage and to use gentle shampoos and avoid traction. Traction meaning pulling the hair tight for certain types of hair styling. If tight hairstyles are used over a long period of time, it can produce something called traction alopecia, especially in the frontal hairline. If the hair is pulled tight and braided or styled in such a way that there's traction or tension on the hair individually. So combination strategies usually work the very best for hair restoration. In my clinic, medications, primarily the either topical or both oral medication with finasteride and minoxidil work very well. I like to use PRP for a jump start to hair growth, and we frequently recommend a low-level laser or low-level or LED light therapy to help stimulate hair growth, giving us overall the best outcome. Maintenance is essential. One thing nice about the oral medications, they can be taken long-term to support healthy hair growth and sustainability. The PRP and laser therapies can be used intermittently. Low-level laser works the best if it's used at least a few times a week. So here are some of the key scientific references that show that these different methods of treatment work for restoration of hair growth, especially in the androgenetic alopecia, which is the common type of balding in men and thinning in women. Thank you very much for listening. If you do have hair loss and you don't know exactly what's going on, again, I urge you first to go see a board-certified dermatologist who can confirm the cause of your hair loss and help you to design a program to regain your healthy hair. Thank you so much for watching.